this is something I think doesn't get talked about enough in relation to VA disability cases. Should VA raters, the people making decisions on VA disability cases, be treated like they're healthcare professionals? I mean, should they be healthcare professionals, or should there be healthcare professionals involved with the making of the rating? Kind of like in Social Security disability, is a completely different question. But should they be treated like healthcare professionals when they're not healthcare professionals? I like having this microphone right in front of me too. It's kind of silly, but of course the answer is no. I mean, VA raters shouldn't be asked to function like a healthcare professional, and yet we see in the VA's policy now, and also in the proposed changes for things like mental disorders and other conditions, neurological disorders, they're being asked to function like a mental health professional. And I'll give you a specific example, which can have a dramatic impact on veterans' disability claims cases, especially like secondary conditions, for example. And I'm a psychologist. My name's Todd Finnerty, if you didn't notice. And I have the website nexusletters.com, and I'll end up referring you to nexusletters.com for like more information related to this, things I've written and everything. But right now, raters are asked, basically, is this a symptom from another condition, or is this a separate secondary condition, a diagnosis or disorder caused by that condition? To just left field give you an example, and depression is one example that they use, for example, in TBI or anything else. Is this depression a symptom of the tinnitus? Is this depression a symptom of the chronic pain? Or is this depression a separate diagnosis, separate disorder caused by the chronic pain, caused by that other condition, right? Guess who has to figure that out? A non-healthcare professional sometimes, right? Like they ask the rater to evaluate that. Unfortunately, as you know, they're not healthcare professionals, and the VA makes lots and lots of errors, as we can see, clear, unmistakable errors. And this could be a pretty significant source of them. Errors which, lead to veterans getting denied, not even really having a fair case, right? Because they don't get evaluated like they should. And that's partly because it's sort of almost an impossible, fallacious BS task that's being asked, right? Like, because depression isn't a symptom. Depression is a whole collection. It's an opinion of a whole collection of symptoms and impairment, right? Different things. So it's like to say, oh, is this depression a symptom caused by this other condition, or is it a separate diagnosis? It's usually a collection of symptoms. It's not, you know what I mean? So we can't just simply say, well, let's ignore that depression because it's because of their other service-connecting condition, right? There's a good chance that should be evaluated by a mental health professional, right? There's countless times now I see lots of records where a diagnosis was missed, a diagnosis was not addressed. Like a primary care doctor will write depression, and then maybe there's the conclusion without an exam, without a CMP, that we're not going to look at that depression. Oh, it's because of something else. It's not, there's no duty to assist because it's a symptom. No, totally disagree. And that's not an evaluation that should be being done by a VA rater, right? Because it's just going to lead to countless mistakes, countless errors, veterans not having their claims addressed appropriately, right? Clear and unmistakable errors. But why do I bring it up? Because it's going on now. It's in all of the proposals for like changes for mental disorders and other conditions. We've seen the issues with how insomnia is being treated lately with the changing guidance. I have another video on that you can go look at. I'm a YouTuber apparently, so I have to tell you to go look at other videos. No. But if you're interested in that, it's definitely worth a look. I even made public comments on recent proposals and used the insomnia as an example. But, these are sort of things that shouldn't be happening. There shouldn't be things like depression in the file, other issues in the file, and not being evaluated by an appropriate professional, right? Whether it's a mental health symptom or any other symptom, especially, a veteran might be filing for a secondary condition for depression. Hopefully that does get addressed, but they can say, oh no, that's a symptom of that condition instead of a separate disorder, right? I mean, it's just not the way things should be, especially when there isn't a mental health professional or a physician or other healthcare professional looking at that question, right? So, a lot of times the duty to assist, and of course I'm not a lawyer or a VA accredited rep, there's all kinds of errors there, and this is probably a source of one of them. So I'm going to cut this down. We'll be moving. If you want to learn more, you can read about my various proposals, responses to the proposals on my website, nexusletters.com. Thanks.